Tonight, we're joined by Dr. David Wohl. Thank you for being here. I think given some of the things we just heard, I want to touch on a number of items. First of all, the president's plan moving forward, really to return to a sense of some normalcy by July 4th of this year. Medically speaking, given the plan, trying to get as many people vaccinated as possible, what's your reaction to what the president has laid out so far?
I think for those of us who are in the business of trying to get as many people vaccinated as possible, this is welcome news. I think we need an ambitious plan, and I think setting a deadline for himself and for the rest of us makes a lot of sense.
So at what point do you think that we'll feel safe gathering with our families, getting out in larger groups, maybe losing the masks, or how long will we be wearing them?
I think most people are very responsive to the numbers that we're seeing, those curves. So new cases, hospitalizations, and of course, deaths. And as we start to see those numbers continue to drop, which we're all keeping our fingers crossed for, I think we're going to feel more safe and reassured. But I do think we have to be careful. We can't let our guard down too early, or we'll see the reverse of what we're hoping to happen by July 4th.
Can you address some of the concerns that people do have about reactions to the vaccines? We heard that report just moments ago, and although many in the medical community are saying that the vaccines aren't causing deaths, you look at the numbers, it's 0.00018% of people who have died after getting the vaccine. What do you think is most important to take away here?
There's plenty of people who also died who didn't get the vaccine, and not just from COVID-19. People will die. We're dying because that's what happens sometimes to people, whether or not they get the vaccine. So there may be no relationship between getting the vaccine. Same thing happens after any vaccine or any event. So I don't think we should lose sight that coronavirus is a very deadly disease. 1% of people who come down with COVID-19 end up dying. And if you're in a higher risk group, the risk is higher. So we know that the vaccine is much, much safer than COVID-19. And we've already lost so many people. This is a way to stop that flow.
530,000 and counting. And doctor, in terms of childcare, I know part of the president's plan is to get kids back in school. We know that it has been difficult, isolation, loneliness, depression for kids who have been remote learning. Lay out your concerns and your guidance when it comes to childcare and return to school.
What's nice is what we're seeing is the science leading the policy. Compared to a year ago, we know a lot more about the shedding of virus among adults and children. And we know that young children do not seem to shed the virus very effectively. So opening up schools makes a lot of sense for all the reasons you mentioned. So much of our life centers around our kids going to school. So if we're going to get anywhere near to normal, opening up schools in a smart, informed way makes a lot of sense. I just think we have to do it with the evidence. And the evidence shows us that especially younger children, and if we have those protections in place, we could do a good job and remain safe.
Before I let you go, Dr. Fauci said 90% of the country may need to be vaccinated in order to get to herd immunity. How likely do you think that is?
I think it's going to be hard. And I think it's nice to have a target. And we aim for that target and we settle if we fall a little short. But let's aim high. That's what we do. That's what we have to do. And even if we hit 70 or 80%, we probably will be good enough. Already, 2/3 of people who are 65 and older have been vaccinated, fully vaccinated. I mean, that's remarkable. And it's only going to get better.
A lot of challenges still ahead, but there is a light at the end of the tunnel. Dr. Wohl, thank you for your time.
Anytime. Thank you.